You're listening to WNZK, Dearborn Heights, Detroit, your ethnic superstation, 690 days, 680 nights.
أهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر وعبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Welcome to Radio Baladi, the best and most effective ethnic radio station in North America. You are the best of listeners. I want to thank you for tuning in and being with us this morning. My name is Khalil Hachem. I'm the editor of wdmv, online magazine, business magazine in the community. Today is a beautiful Friday. It's a beautiful day, Friday, February 26. It is cold. Temperature is about 22 degrees, expected to rise up to 31 degrees. However, the weekend is expected to reach 55, maybe 40, 55, something like that. So no complaints here. We have a wonderful program for you this morning. We will be discussing the Zika virus and other health concerns with Dr. Mouhanad Hammami. Also, later on in the program, we'll be talking to Dr. Suwan, Nesreen Suwan, about the ever-changing family values and how they affect Arab Americans. You can join the conversation today if you have any questions, comments at 248-557-3300. Is Dr. Hammami with us? Good morning, Dr. Hammami.
Good morning, Khalil. How are you?
I'm fine. How are you? I want to thank you so much for being with us this morning. I'd like to remind our listeners that Dr. Hammami has been with us before. We are so glad to have you. He's a graduate of Aleppo University in Syria, and he completed his postdoctoral research in pediatrics at Newborn Center of the University of Tennessee in Memphis, and then accepted a faculty appointment at Wayne State University School of Medicine in Detroit and a research position at the Detroit Medical Center Department of Pediatrics. Dr. Hammami was involved in various research. He currently serves as the director of the Wayne County Department of Health, Veterans, and Community Wellness. He is a member of several professional and honor societies and has many publications in various medical journals. We as a community are very proud of your accomplishment and want to thank you for being with us this morning.
Always a pleasure for the intro as well.
I appreciate it. Appreciate your time. One of the main concern is, and yesterday I was reading about it, that there is a case in Michigan, the Zika virus. What are we dealing with here, Doctor?
Okay, so Zika virus is a disease that is transmitted by mosquitoes, and the reason it is probably creating this much hype is because it was never encountered in the Americas. Normally, Zika was endemic of Africa and some parts of East Asia until mid-2015. There was the first case in Brazil, and then it started spreading tremendously in South America. So in terms of how it is transmitted, it's transmitted by a mosquito that is called Aedes aegypti. The good news is that this mosquito has not been found yet in North America. So as you might know, Khalil, especially during the summertime, yes, we as the health department, we put mosquito traps and we inspect what kinds of mosquitoes. So far, we have not found any of that species itself. The other good thing is that because of the cold temperatures, then this weather is not conducive for mosquitoes to breed yet. So we are safe because of that weather and all that. All the cases that have been documented in the States are from people traveling to areas where this virus is now active, and specifically like Mexico and Latin America, the Caribbean, and so forth.
Yeah. So this is not really a new virus, is that right?
No, it's not new at all. It's been, as I mentioned, it's been found elsewhere in the world, and especially in Southeast Asia and in Africa. But specifically, the shift from geographically moving into other continents is what is now newsworthy and what is getting people a little bit excited and maybe a little bit worried. I think what is very good about the timing of your program, Khalil, is that now with spring break and now with people wanting to travel to warmer
weather,
regions. And specifically, like my family, for example, in 2 weeks are going to go to Mexico. So what we are advising a lot of the young students as well as families that are considering a spring break vacation is just to take precautionary measures, some common sense in terms of how do you prevent yourself from being bitten by a mosquito. So mosquito repellents, insect repellents, wear long sleeves, all those are things that you should adhere to, regardless whether it's Zika or West Nile or any other virus.
Go ahead, I'm sorry.
The same thing applies to also as the weather gets warmer, then for here in our homes, in our backyards, is to make sure that we get rid of the medium that allows for mosquitoes to breed and lay eggs. So any stagnant water, any bird bath, old tires, cans, things that collect rainwater, these are the ones that the mosquito lays eggs in it, and this is how the mosquito reproduces.
So we can eliminate the breeding ground for them.
Right, exactly.
Okay. How would I know, what are the complications of the Zika virus?
So the symptoms of Zika, and let's emphasize as well, is that only 20% of people that get the virus show symptoms. So it's about 1 in 5. And the symptoms manifest themselves as anything that is similar to common cold. So fever is the most common symptom, some rash on the abdomen and the limbs, and sometimes muscle pain. So the symptoms aren't severe enough where someone says, I need to go see a doctor or I need to go to the hospital. And this is where not documenting the cases becomes a problem, because you say it's a common cold, in a week I will get over it, and most likely in a week the symptoms are going to go away. But the virus stays in the blood for another week, and this is where the infectious period happens. So if someone is showing symptoms and then the symptoms are gone and is bitten by a mosquito, then this is how the transmittal happens.
It can be revealed through a blood test, is that correct?
Yes, yes, exactly. So the diagnosis basically is done based on a travel history or contact with someone who had it, the symptoms themselves, and then a blood sample to detect the virus is the definite diagnosis. There is another mode of transmission which is rare, but it has been documented as well, and that is through sexual contact. So a man, for example, who has the virus in his blood, it can be also excreted through the semen. So again, if someone is showing symptoms or have traveled to an area that has the virus, then we advise that either to abstain for a period of 2 to 3 weeks from having sexual contact, or to use safe sex as with any other sexually transmitted disease. Now, the complications that you mentioned in terms of, because as we have said, the symptoms and the disease itself aren't severe enough, but the complications happens if a woman gets infected during pregnancy or right before pregnancy within a week. And this is where some documented cases of microcephaly have happened in the fetus. So microcephaly is when the brain doesn't grow and the child is born with a small brain, and that causes severe disability. This is truly Yeah.
Can it be passed on through breast milk?
No, not at all.
Okay.
Breast milk has so many antibodies that prevent many of the viruses or the bacteria to be transmitted. So it's absolutely not. It can, however, be transmitted through the placenta because we're talking about blood
Yes.
passing through. And this is how an infant or the fetus can get it and get infected, and that can cause microcephaly.
Sure.
So again, there are some guidelines, especially for mothers in a reproductive age or mothers who are expecting to get pregnant or are pregnant. When they travel, if they truly want to travel to those areas, then again, we ask to make sure that they are protecting themselves from the mosquito bites. And then after they come back, the CDC has recommended that within 2 weeks, you need to do a blood test and monitor the symptoms if they ever happen.
What's the treatment if somebody is infected?
Currently there is no treatment for Zika virus. There has been several trials where they're trying to develop a vaccine for it, but the problem with these viruses or seasonal illnesses is that by the time you are close to have a vaccine developed, then there is no longer an epidemic where you cannot test it on a large amount of people to see if it's effective or not. So you wait for the next cycle.
Sure. This woman that it was reported came to Michigan with the virus. Normally, what kind of precautions, like when they found out, is she being asked to, not get in contact with people? I mean, what's
No. We should. That's not necessary. So as of yesterday, Michigan did not have any cases. We have now one case in Ingham County, and it is a case of someone who traveled to South America, and that's how she got the virus. The test has been confirmed. Currently, she is being monitored for any symptoms. Since the mode of transmission is either blood or through sexual contact, then any normal contact such as touching or being around a person is not going to be an issue. So again, the precaution is not to exchange needles, for example. Be careful if there are open wounds or any blood exchange, and that's it. And hopefully, if there are no symptoms and all that, this is only a matter of 2 to 3 weeks, and then everything should go back to normal.
Sure. So it does not really stay in the body after 2 weeks. Yeah, it gets burst out of the body.
Yeah.
Which is really good news. The other thing is, it can be transmitted sexually from both, not just from man to woman, from women to men as well. Is that correct?
Right.
Okay.
Right.
Yeah. When fluid is exchanged and things like that. Is that correct?
Yes.
Yeah. Okay.
Yes.
Yeah. And where can we find information on that if people really want to learn more?
Our Wayne County website, waynecounty.com, has some information, as well as the CDC has a complete page with infographics and flyers, and they have it even in different languages at cdc.gov.
Are there, we're not at a point where we really need to hold any, special meetings to talk about it. I mean, seems to be...
We not at this point, since, again, it is very rare to have it here in Michigan. We have, however, issued several press releases. We are sending all the schools and university general precautionary measures. We're in contact with our primary care providers all over in Wayne County to make sure they look for the symptoms if they ever encounter someone. So at this point, again, and just like radios like yours, your show would be beneficial for the public to be aware of where it is, what it is. And again, as you know me, I always emphasize that we should not panic. We should not. We should know the fact and react based on the fact. So again, precaution and prevention is the best medicine.
I think this year, since we've had a warmer winter, we could expect a worse mosquito season. And this may be, we wanted to really highlight that because this could happen, as you well know. I mean, this is Michigan. We never know when winter is going to end. But normally if there's a warmer winter, then we may, and wet summer, we can end up with, a pretty bad mosquito season. So this is really, we wanted people to really know more and more about this, and I'm sure that you'll be on top of this as well.
Absolutely.
Yeah, what we want to do is take a short break. We have a caller, and first we need to take a short break, and we'll be right back with Dr. Hammami.
Jumana K-Ruz. You've seen her images on giant billboards across the metro. Jumana K-Ruz. You've seen her images on buses across the city. Now get to know Jumana K-Ruz.
It's sad, but it seems like we live in an age where most lawyers are focused on the bottom line, the money. And a lot of people have stopped wanting to truly advocate. I'll never forget this case. This woman chose me as a lawyer of last resort. She was hit by a semi-truck. I was able to recover about $480,000. Not every lawyer is an advocate, but every lawyer should be an advocate.
Let Jumana K-Ruz protect your rights. Call the law offices of Jumana K-Ruz at 1-866-YOUR-RIGHTS, extension 100, or visit yourrights.com.
Are you going to start a restaurant or grocery store soon? Do you need floor plans and designs? Call Naji Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Naji Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design. New location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Naji Abood, 734-744-9796.
Welcome back to Radio Baladi. We're talking to Dr. Mouhanad Hammami. He's a Chief Health Officer at Wayne County, and we've been talking about the Zika virus and we're going to be also asking about other health concerns as well. The number here is 248-557-3300. Good morning, Jerry.
Mr. Khalil Hachem. Good morning, Mr. Khalil Hachem.
Thank you for calling. I'm fine. How are you? Go ahead, please.
Very good. Thank you for taking my call, and I want to say good morning to Dr. Mouhanad Hammami.
Good morning.
Dr. Mouhanad Hammami, Jerry Habba, want to address, I know you are talking, Dr. Hammami, about the Zika virus, and I just see, Dr. Hammami, there is some kind of system similar to Zika virus in children who they were sick from the lead water in the city of Flint, Michigan. I saw, Dr. Hammami, some children when they were poisoned with the lead in their brain. The head, the face has similar sizes.
Jerry, do you have a question in regard to the Zika virus?
Absolutely.
Yeah.
I just want to say to Dr. Hammami, do you think what's happening in Flint, Michigan water could be a good environment for the Zika virus? And I want to thank you.
Thank you, Jerry.
Dr. Hammami.
Okay.
Thank you. I think it's very relevant to talk about the Flint issue, but I assure you that the two cannot be related. Now, we all know that high lead levels in blood, especially in children, would cause neurological disorders that can cause developmental disorders as well. I am not aware of cases of microcephaly because of high lead levels. However, the symptoms or a microcephaly would get you to a disability phase neurologically. So can chronic poisoning, chronic lead poisoning from lead. However, it is not as severe. But let me make sure that we're talking about two different things. We're talking about a mineral that is found in water where chronic exposure in high doses can lead to neurological disorders. And then we're talking about an infectious disease that is a virus that is caused by a transmittal through a mosquito. So the two are completely different. Maybe the outcome might be similar in some cases, but tomorrow, let's say, if there is a case in Flint, then whatever the water issue is, that will not increase the chances or decrease the chances of the infection itself.
They're totally two different issues, and this is why I don't want them to be confused. What other health concerns should be, this normally February is the season for flu and cold, and how are we doing there? What kind of cases you're seeing?
Well, as you said, Khalil, we've been fortunate until maybe yesterday that we had relatively very unusual mild weather. So we did not see the severe cold. We did not see the severe cases of flu. However, we keep emphasizing that prevention is the best medicine. We probably have passed now the seasonal flu or the season where flu is spiking. We're now getting into spring, so that should be good. I think with spring, and especially if we have a lot of rain and we start seeing warmer temperatures, then one thing to start looking at maybe in March, April, and May is the West Nile virus. Again, another virus that is spread by mosquitoes. Unfortunately, this mosquito is found here. Every year we do a lot of campaigns, media campaigns about West Nile virus and how to prevent. The difference between, let's say, the mosquito from Zika and the mosquito from West Nile virus is that West Nile virus, the mosquito bites early in the morning or late at night. Zika happens all through the day.
Sure.
So again, precautions, the breeding environment, the insect repellents are going to be, especially with the warmer weather in the spring and children going out for soccer and playing outside and all that, then we advise our residents to make sure that they're using a spray anti-insect repellents or something of that sort.
Something with DEET in it or something like that.
Yes, yes. Yeah. So that definitely is something we keep an eye on. As far as the flu, I doubt that we will see any uptake in the flu virus. However, there is something to keep an eye on always, and that is the norovirus and
what is that?
Norovirus is a food-transmitted virus that causes gastroenteritis, so kind of like food poisoning. We have had, and this is especially when you have people in nursing homes, or if you have big banquet halls where they are not, a food preparer is sick, and it can be transmitted through food. So this is where our environment.
How is it transmitted? Through touching the food, or?
Yeah. So let's say a worker who. So gastroenteritis, as you know, would be someone who has diarrhea or vomiting, and let's say they used the bathroom, they didn't wash their hands properly, and now they're preparing food for a large amount of people, and now the people are eating this food. Then that can create at least like 20 to 50 people getting sick. So these are the things that we always emphasize.
So the key there is to, practice good hygiene and washing our hands.
Exactly. Exactly. Okay. And if you work in a restaurant, or if you work in a nursing home, or you have a job where it gets you in contact with a lot of people and you feel sick, then it doesn't hurt for you to take the day off and stay home. This is absolutely a necessity.
Yeah. My wife was telling me, she teaches at a school. She's a teacher assistant. And somebody came in sick to that school. Then before you know it, everybody else was sick. And, and had she had that person really, stayed home, I think she would have saved the school and everybody else a lot of headache.
Right. And that applies, of course, to everything. If you
absolutely.
have the flu,
Absolutely.
if you have norovirus or irregular flu, then definitely we encourage parents. We know that it's a hassle. You might need to take time off and stay with your child and all that. But think of the others, and that is a small sacrifice in order to prevent others from getting sick.
Absolutely. If we always talk about this, and they're very simple steps, which is just keep your hands washed, keep your hands away from your face. They're easier said than done, but if we can practice those. The issue in Flint really made us all very wary of tap water. I used to think that tap water is one of the best water, specifically here in Michigan. We get really, really good water. But right now, specifically with children, every time I look at tap water, I'm more suspicious. What can we do to really ensure that, we can restore our confidence in tap water?
That's a great question, and I bet it's in the minds of many of Wayne County residents as well as the city residents. And it's unfortunate that the Flint crisis have created such suspicion, but I think the silver lining is that now people are a little bit more educated about lead and they're more aware of it. So there are, first of all, let me make sure that when we talk about the water source for Wayne County and for the city of Detroit and the neighboring counties, it is not the same source of water that caused this crisis in Flint.
Exactly.
So, and then the next thing, and this can be, you can go on, I think the Water Authority's website. They publish periodic reports about the quality of water as it leaves the Springwell facility, treatment facility. And there are certain levels for many contaminants, including lead, that are measured every quarter, and we make sure that they are within safe levels. Now, what happened in Flint is that when the water leaves this water facility, there are certain chemicals added to it. So when it goes through pipes that are made of lead, and many of the homes that were built in older ages have lead pipes, or have pipes that might leach into it. So there is certain chemicals that are added that would prevent the leaching of lead into the water. That did not happen in Flint when they switched to the Detroit water. That chemical was not added, and that caused many of the older houses in Flint for the lead to leach into it, and they didn't catch it at the right time.
Sure.
So we know in Michigan, in Wayne County and in Detroit, that these additives are preventive, and any concerned resident can send a sample of the water that is coming from their tap to the state lab. I think it costs like $18, and they can send them everything that's in it specifically for lead. In fact, at our health department in Wayne, on the corner of Van Dorn and Benoit, we are giving those water testing kits for free. So anyone who is concerned can go and get a water sampling kit. All they need to do is open their tap water, fill it in, and send it to the state, and usually within a week or two they would get results.
If water has a high lead content, can you tell by looking at it, or does it have to be tested?
No, it's not something that you see or taste.
Okay.
So the best thing to do is to test it if you are concerned. But the other, reassuring thing that I wanted to bring as well is that we at the health department as well in Wayne County, we do a lot of blood testing for those that are enrolled in our WIC program. In fact, every child that comes to our WIC, we do blood testing specifically for lead. And there is a program as well that's called CLIP, which is Child Lead Prevention, Child Lead Poisoning Prevention Program, where private physicians as well, pediatricians, randomly select samples of blood and they test it for lead. And we monitor those reports on a monthly basis to see if there is any high levels in certain areas, or is it just the norm. So I personally have reviewed every blood test that we have collected since 2013, and we did not see in Wayne County any abnormality as was discovered in Flint. So there is nothing above the norm.
That's very good,
Yeah, and that gives me an assurance level that we do not have this crisis where the source is the water. Now, of course, it is important for parents to know that lead isn't only in the water. Lead can be in paint, it can be in dust, especially in houses that are built before 1970, where lead-based paint was very common. So for that, if they're concerned and they a blood test in their child can tell us if there is a higher blood level, and usually the high blood level and lead blood level in a child would prompt us to send an inspector that goes and inspect the house, and we inspect everything in terms of lead and paint and all that. And if the house qualifies, then there are certain funds through a HUD lead grant that we can remediate the lead.
Wonderful.
Yeah.
Wonderful.
So this is something for our Wayne County residents to consider.
Is there anything I haven't asked you that is important in regard to the the topics we discussed today?
I think you covered it all, Khalil, as usual. It's been it's my pleasure, and it's been very exciting to talk to you and to your listeners. I think again, what I would like to emphasize is prevention and common sense, and then just live healthy and live well.
Thank you so much. I really appreciate your time. I know how busy you are. I just want to thank you so much again for being with us this morning. As always, we've enjoyed talking to you, Dr. Hammami.
My pleasure.
Thanks again.
Yeah.
Bye now. Please stay tuned. We're going to take a short break. We'll be right back.
Life for Relief and Development is a nonprofit charity that has been providing humanitarian aid and development to people and communities regardless of race, color, religion, or cultural background for over 22 years. When disaster occurs here or around the world, Life rushes to provide food, medical aid, and shelter to those in need. Life also has development projects to provide medical relief, water purification, educational programs, relief for orphans, and much more. Your help and support can greatly improve these efforts. All donations are tax deductible. For more information, please visit our website at lifeusa.org or call 248-424-7493. That's lifeusa.org, 248-424-7493.
Ziyad brand. Quality products from our family to yours. Ziyad Brothers Importing offers the finest quality products, including brands like Sultan, Kraft, Nestle, Hook, Rico Picon, Donna, and many more. Ask your retailer to carry these fine products because you deserve the very best. For more information, visit our website at www.ziyad.com. That's www.ziyad.com. Ziyad, quality products from our family to yours.
From their first words to first grade, Dreamy Children's Center will help get your child on the right track. The highly qualified staff works closely with parents to provide an experience that goes beyond early education. We can help nurture important personality traits with the use of educational programs ranging from preschooling for infants to Montessori-approved programs and bilingual curriculums for young children. All meals can be provided and we can arrange for after-school pickup. Dreamy Children's Center in Dearborn Heights on Warren, in Westland on Ann Arbor Trail, and in Troy on DeQuinder.
Welcome back, and thank you for being with us this morning. Again, my name is Khalil Hachem, and we've been talking to Dr. Hammami. We talked about the Zika virus. We also talked about the seasonal flu and the issue with water and Flint and how does it really affect us. And we want to thank Dr. Hammami again for his information, for his input. You can find more information about all these different topics at the Wayne County's website as well, and we're going to be bringing some of these information to our website at yamichigan.com. That's yamichigan.com. These are very important topics. They are in the news, and once the danger of any topic is when we don't know what's going on and we try to draw conclusions based on misinformation and not complete facts. And basically, Dr. Hammami says that the Zika virus is not local. That means we don't have any mosquitoes that tested to the virus. This is something that was originally came from Africa, then was found in Brazil. And for those of you who soon will be traveling to either Mexico or any other warm climate, to be careful, to be aware, practice caution, and wear long sleeves if you have to, and use mosquito repellent. If you feel any symptoms, experience any symptoms, try to find out what it is. And he said this can be transmitted either through mosquitoes or through sexual encounter, through blood. That is, it could affect unborn children if someone is pregnant. So be careful. The other issue, they are really common sense. And as Dr. Hammami mentioned, if someone is sick, stay home. I'm talking about the flu now, or any other, viruses. If, someone is sick, stay home. Do not take your virus to work, and practice these simplest things. Wash your hands. Don't sneeze in public. Try to use your hand to cover, your elbow area, to cover your face when you cough. Very simple stuff, and nothing better than washing your hands with soap. There are people who, we make these mistakes, I should say, and just be conscious of it. It's not that difficult. In the news as well, the other issue we talked about was water, and the water in Flint, and how can we be protected, and we get really good water here. The Detroit water system is a very good water. Detroit Water Department serves 26 counties. Flint was not on that water when that issue happened, and so we get really, really good water. If you're suspicious of your water, as Dr. Hammami said, you can always take a sample of water and give it to the county to test it, and there is help there if you need to. They can answer questions. Give us a call. We can help you finding questions. The number is 248-557-3300. In the other half of the program, we're going to be talking to Dr. Suwan. She'll be talking to us about family values and the changing family values and how they affect the Arab American community. In the news, yet another shooting. In the program, originally I was going to take a minute to, send our prayers and thoughts to the people, the victims, and the families, excuse me, in Kalamazoo. And this morning we learned that there's just another shooting in Kansas, 3 people killed, 14 hurt. A co-worker, brought in a gun and shot at his fellow employees. We also send our thoughts and prayers for those victims and families, and we hope that sanity will reign, and we don't have to really hear about it. In the past, I don't know how many days we've had 11 shootings. This is really concerning. So another fiasco of the presidential election debate, the Republican debate, with Mr. Trump and Mr. Rubio, Mr. Cruz, and trading insults and promoting that environment of what's the word to describe it? It's one of the most hilarious shows you can see. My concern is, how it ripples into the minds of people. It's not politics of fear, but it's more the anger that comes out of that, and everybody is so angry, and this is supposed to be civilized. They're supposed to be civilized debates where people tell us how they're gonna serve and protect America, not how they are going to accuse each other. And it seems like everybody tells us how bad the government is. Well, we know it is, or we suspect it is. What are you going to do about it? This is what they're not answering. What are we going to do about it? So unfortunately, even my 9-year-old son is said to me, Dad, why do we have to listen to this fighting? And they are fighting. They're like mad men, and standing there and fighting amongst each other. Well, we want to know. We want to vote. For example, I'm an independent voter. I just want to know who to vote for. What are they going to do about the economy? What are they going to do about to protect this country. I just want to know what their plan is. Everybody stands there and tells me how bad the other guy is, and how bad the President Obama is, and how bad this. This is not the issue. The issue is what you're going to do, and what is your plan to serve 4 years in the White House. What are you going to do? We still don't know. One guy says he wants to build a wall, and the other guy said, I want to build a bigger wall. And this guy, I want to keep these people out. The guy says, I want to keep more people out. It's just like childish game. We need a true adults to run for president, and I don't see any adult running for president right now. It's unfortunately. It's really true unfortunate. So we hope that changes. And then I'm very disappointed in how the media has played this issue. We're promoting all of these anger, ruckus, yelling and accusing and using foul language and using terrible language and preaching hatred against this group and that group. And it's so unfortunate, and it's really, it's terrible. Anyway, there are a lot of issues going on. Do we have a caller? Dr. Suwan. Good morning, Dr. Suwan.
Good morning. How are you?
How are you?
Fine, thank you.
We were just talking about the childish games of presidential elections. What is going on? What are they doing to our values?
Yeah, we are really stuck.
Terrible. I don't want to vote for the least bad guy. I want to vote for the good person. Show me.
Too. Me too.
And always we have to select who is the least worst among the bunch. It's terrible. So how you been, Dr. Suwan?
Oh, I'm fine. Thank you so much.
Wonderful.
Yesterday, as a matter of fact, we were in a board meeting with the Arab American Family Services, board members, and we were talking about families, and, I was talking to them about my program with you today.
Sure.
And we were talking about the most important things that we should highlight.
Yeah. And it's just, what are some of these things?
I think the most important thing that we should talk about today would be family values.
Okay.
And we should define what are we talking about?
Exactly.
So family values, they involve all the ideas of how you want to live your family life, and they are often passed down from one generation to the other. And it's very important for us to know that what we do is what our children will learn. It's not what we are telling them. And the most important thing, that in family values is to start with establishing a family. This is very important because, we are talking today about, what is different, between family values now and family values before. I think that the most important thing is to start with establishing a family. Do you agree with me?
Absolutely.
Because, sometimes, I feel that nowadays people just feel, oh, why should I get married? Everything is available everywhere, so why should I get married?
The concept of family has changed over the years. I mean, in the old days, a family was, a man gets married and to a woman, and then they have a family. Today, the concept of family has changed, and depending on, how conservative and how liberal we are, and then what is family is really up to in the eye of the beholder. So
and I think that the most important thing is, as I told you, is to establish a family. This is number one. And then if we establish a family, to live by the rules or to live by all of our promises, because remember that in each marriage, in every marriage, the promise is to live together in a holy marriage, and from a specific day forward, for better, for worse, for richer and poorer, sickness and health, and to love and cherish till death of any party, and it is like a total commitment. So basically, this is extremely, extremely important. I mean, I do believe that marriage is a promise, and, marriage is a commitment. And marriage is a responsibility for the spouse and a responsibility for the children. Unfortunately, nowadays, you feel that marriage is just like, a paper. It could be torn at any time, and then, as if nothing happened, even if the marriage is like, was for like 10 years.
So what happened? What happened over the years?
Yeah, it's just like a tragedy. I do not know.
Something happened over the years because, the concept of marriage, again, has changed. And people, as you said, they're not as committed, and they're not they don't really hold that value like in the old days they used to.
Yeah, it's really so sad. And the problem that, if something like that is happening, like, after 10 years or 20 or 30 or 40, even like, nowadays we are hearing about disasters where, marriage could be broken after 40 or 45 years or even 50 years. I mean, I do not understand, if somebody has been, like married to somebody for like 45 or 50 years, and they, now I think that, I think that I should be starting, like all over again, and I should start looking for another life, after being, 50 years with somebody. You know what I mean? It is so funny, and it is so sad. The problem that, something like that is drawing the line, or the drawing, like a plan for future generation of what they need to do, and it will just like let them feel that there is no confidence in life, and there is like no commitment. Family values are not really values. Anything could happen. So
we don't value them anymore.
Yeah. So basically, they are not values anymore. No. So basically, I want actually, to talk about, what's happening, in our, board meeting yesterday. We were talking about, so many people are just like not responsible for their children. And I really do not want to say that, of course, mostly they are men. I don't want you to be angry at me. I want to keep, being in your program. So, unfortunately, some men will just, leave their kids in any age, and then they have no idea that, they are responsible for them. So this is really, really very unfortunate. I mean, like in our culture, we are responsible for our children for the rest of our lives. And the most important thing...
Yeah. What we're going to do is, Dr. Suwan, we're going to take a short break, and we're going to come back. We have a caller, and she's going to be asking a question as well. Please stay tuned.
Sure.
Yeah.
قشات ميديترينيان ماركت بإدارة سهر قشات وأولاده يرحبون بالجالية العربية والكلدانية. جميع أنواع المواد الغذائية، البان طازجة، الكرزات والبهارات الطازجة. داخل الأسواق مطعم ميديترينيان شيش كباب يقدم يوميا جميع أنواع الكباب، المقبلات العربية العراقية وصواني الكامبو المميزة. تفتح الأسواق من 8 إلى 9 مساء من الاثنين وحتى السبت، ومن 8 صباحا إلى 9 مساء يوم الأحد. تقع الأسواق على 32839 نورث ويسترن هايواي في مدينة فارمينغتون هيلز. لحوم حلال للجالية الإسلامية. لطلباتكم من المطعم كول 248-538-7855. That is 248-538-7855. قشة ميديترينيان ماركت، خدمة متميزة ومعاملة راقية.
مسافر وحدك وفايتني.
أمتي ترافل للسياحة والسفر بإدارة نبيل الباشا تعلن عن افتتاح مكتبها الواقع على 28695 راين رود في مدينة وورن. خدمات متميزة وخبرة تفوق 20 عاما نضعها في خدمة عملائنا الكرام. مع أمتي ترافل يمكنكم حجز رحلاتكم الجوية داخل أمريكا، الوطن العربي وأنحاء العالم، إضافة إلى الأماكن السياحية والاستجمام. للحصول على أفضل العروض وأنسب الأسعار ولمزيد من المعلومات اتصلوا على الرقم 586-578-9666 9126 586-578-9126 أمتي ترافل عنوان للصداقة والثقة. أسواق زمزم الواقع على 24065 أورشاد ليك في مدينة فارمington هيلز ترحب بالجالية العربية والكلدانية. تنزيلات كبيرة على عموم المواد الغذائية في يوم الأربعاء من كل أسبوع. لا تنسوا فريش كاري اوت، جميع انواع المعجنات، وايضا صواني الكمبو المشكله والصمون الحار. لحوم حلال الجاليه العربيه والاسلاميه، الملحمه باداره قصاب الجاليه المعروف سلوان جربوع. زوروهم على 24065 اورشاد ليك في مدينه فارمington هيلز او اتصلوا بهم على 248-476-0300. اسواق زمزم للمذاق عنوان لجميع طلباتكم، اتصلوا على 248-476-0300. اسواق زمزم للمعامله الراقية وكرم الضيافة عنوان.
Welcome back and thank you for being with us. We're talking to Dr. Suwan about the changing family values and how they affect Arab Americans. We have a caller. Is that Hanan on the phone? Did I say your name correctly?
Yes.
Okay.
Thank you.
You're welcome. Could you please ask your question quickly since time is an element?
Yes, a couple of minutes ago, I opened the radio and the doctor was saying that she doesn't understand why after 30, 40, 45 years of marriage, couples separate. This is not in my case. I'm a happily married person. Thank you. But sometimes it takes a toll on you. Living with a person that you don't get along, you always fight, you don't like each other, you don't love each other, you insult each other by any move. Sometimes it's better off. It's better off by yourself.
What's the question?
No. My question wasn't, I have a comment. I understand. I know couples, older couples, that better off by themselves. People don't understand. They say, why did you wait until 34 years of marriage to get divorced? Well, you wait and you wait and wait. And you hope and pray something will work out and then you get along. After all, it takes a toll on you staying with that person that you don't like. You know what I mean?
Okay. Thank you.
That way you're free. Thank you.
Thank you, Hanan. Appreciate it.
All right.
What do you think, Dr. Suwan?
So my comment, I mean, this is something that you will know in the first, few years of marriage, 2, 3, 4 years of marriage, 10 years of marriage, but not after, 50 years. And also, one of the, some of the family values is, to never give up and, to be patient and also, to take personal responsibility. The problem, with all of these, I would say, being apart after 50 and 60 years, I mean, the children, they will just lose, trust in the whole world. And most important thing, I mean, right now, we cannot say that, okay, they are always fighting. Okay, what is the reason for fighting? If, for example, a woman, she doesn't want her husband anymore because she finds, for example, a wealthier man, or, for example, a man does not want his wife at all because he found maybe, a younger woman, or maybe he found somebody on the social media, or, those are the cases that I am talking about.
Sure. What Hanan is saying really is that after a while it takes a toll on you and people just don't take it anymore. So what can be done to change that and, to preserve the marriage, for example?
Most important thing that, we have to understand that most important thing is to invest in your family. I mean, it's important to invest in your family and not to invest in trying, to, I would say, to be richer or, to invest, more hours at work, endless hours at work, and to try to protect your investment. And also, most important thing, that do not give up your family once you found, once you find somebody else.
Sure.
You know what I mean? I think,
Absolutely.
There is also, I mean, she's talking about, they are not, getting along anymore. But, we forgot that there is a huge issue in life right now. called, cheating and, betrayal and, somebody who is, okay, I spend with my wife, for example, like 50 years. She is the one who supported me when I was in debt. She's the one who worked with me all of her life. Now I do not need her anymore, and I can find somebody who is, maybe younger, maybe, on the social media or somewhere, or, at work, or, scenarios like this, they are happening, every day, every day.
So the question here is, should I try to make it work? I've invested 30 years with this person, or you know what, we've been at it for 30 years, it's not going to work. Why don't I find somebody and live a few years, the few years of my life happy?
Of
so
course,
this is basically the question that most people are really faced with. And as you said, since our society are changing and people are not less restrained by the commitment of marriage, you're going to see more people saying, well, I can't work it with this person, maybe I can work it with the other person.
Yeah, the thing that, if you are spending 50 years of your life and you think that at the end of 50 years, it hasn't been working.
Why did you wait 50 years?
Really. I remember, we see cases of cheating, every day. We cannot say, okay, I don't like her or I don't like him after 50 years. It is the time where, people should actually start, enjoying their grandkids. They are supposed, to take care of their kids and grandkids. It's not the time to say, as a matter of fact, I wasn't happy for 50 years. I think that this is a big stress.
Be serious from day one. Select the good relations. And, a lot of people don't know that marriage, you have to work on it. It doesn't just happen.
Exactly.
You have to work on it, and relationships don't just, it's not like you buy it like a tomato, you buy it, it's already ripe and you eat it. You really have to nurture it. And we don't have a lot of time left. Very quickly, in the last minute or so we have left, what can we do, Dr. Suwan?
As a matter of fact, I want to mention a study that was conducted at Harvard University, and it's a very long study that was actually, done over 75 years, and it was on some people that, they followed since the 30s until now. We are talking 75 years, and when you look back, what was the most important thing in your life, or what is the one only thing that you hope that you invested all of your life in? And they found that it is, family and, good relationships. Family is the most important thing. And everything starts with a family and ends with a family.
Absolutely.
And I would say that, family, it's not an important thing. Family is everything, and family comes first. And this is what I live by.
I think we should return to this topic because it's a very important topic. I want to thank you so much for being with us, Dr. Suwan, and thank our listeners. This is really, I think next time you should join us maybe a little bit earlier than 8:40 because this is a very, very important topic, and you have an incredible experience in this, and we really want to thank you for all your information today. And is there like a website people can turn to or something like that?
You wanted me to talk about family values. I wanted today to talk about cool sculpting.
We ran out of time, but we're going to have to come back and revisit it, yeah.
Yeah, you told me, no, we want to talk about family values. Sure. And, I think it is very important.
Sure.
And, we can always talk about it.
No problems.
Yeah.
No problems. Thank you so much. We want to thank all our listeners. We've had a really great hour today, and thank you, Dr. Suwan, and we'll see you next month.
Thank you.
Bye now.